The Health Quest Chiropractic Team are committed to bringing Albuquerque better health naturally by teaching and practicing the healing principles of chiropractic. And combining the skills and expertise of chiropractic and wellness is Dr. Alan Miner, who joins us today. Welcome, Dr. Miner.
Thanks for having me. Great to be here.
We've been looking forward to this. I'm so happy you're finally here with us. So much to talk about. First, many people really don't understand that when they think about wellness, they don't necessarily correlate it with a visit to the chiropractor, but your practice is actually a little bit different because it's about a whole lot more than just adjusting the neck.
That's
and
right.
A lot of people think that, right? You have a very unique approach to health and to wellness. So tell us a little bit about that to get started.
We do. Well, we recognize, first of all, health starts in somebody's central nervous system. The signal from your brain controls everything your body does. Every organ, every cell, every tissue. So health starts, really a good foundation is a healthy nervous system, which most people never even think about. Then you add in a healthy diet, proper sleep, nutrition, exercise. And what we know in our perspective in approaching health and optimizing a person's health is if we get all those things in the right place, going in the right direction, your body has an amazing ability to heal and to repair itself.
That's amazing.
Yeah.
I don't think a lot of people think that way. And what's so nice is that Health Quest actually works with children also. And you also work with families. You work with pregnant women. So you could work with Beyonce now. So, yeah. But, you know, I would wonder this. Why would a child need an adjustment?
That's a great question. And I think a lot of times people hear that and they picture maybe how we'd adjust a pro athlete, which is entirely different than how we care for a child. We use these tiny little instruments to very light impulse. But you know, I have 3 children. My 1-year-old Giselle is learning how to walk, and she's beating herself up. I mean, she's fallen into everything. I have a 4.5-year-old Landon and our 2-year-old Verity. They're wrestling, they're falling off the couch, they're diving into it. So what happens in children is they get these impacts, these traumas can shift those tiny vertebrae, those spinal bones, cause a misalignment that affects that nerve signal trying to get from the brain to the body. So we end up caring for a lot of families in town. About 20% of our practice is children. And the reason parents bring so many of their children is oftentimes they've had problems with ear infections, with asthma, even things like autism, where these children aren't responding to traditional care. And when we start adjusting, all of a sudden we see their bodies function better, we see these health problems clear out, and a lot of times it's those traumas, even the birth trauma. If you think about how many children are born today with forceps or through C-sections, that puts a tremendous amount of stress on the spine and can affect that child's health for years to come.
These are things people don't think about.
No, not at all.
Well, this is the other thing that people do think about is I think what happens is sometimes people get very concerned that if they actually do an adjustment that they might see some damage to bones that maybe they didn't have even before, and some of their ligaments could get damaged from those adjustments themselves. Is that an actual concern that's valid?
There are certain cases where, people have severe arthritis, osteoporosis, maybe if somebody's had a spinal surgery, and we have to be delicate in those situations. But that's why, you know, we do a thorough evaluation, we do x-rays, we know exactly where we're going and what we're adjusting. And again, now in chiropractic, there's a wide range of technologies for us to use to adjust a person. So it's not just maybe that mental image of the real manual adjustment. There's a place for those, but we can also use, like I said, handheld instrument, tiny drop tables, so we can get very precise, but also be very gentle so we can get the correct adjustment the person needs, but in a safe way.
Well, once you get started, do you have to keep it going? Is it that type of
No,
thing?
I think a lot of times people think that, like maybe chiropractic somehow addictive or something. It's not. It's funny to me because nobody ever thinks of it that way with the dentist. You know, once you go to the dentist, you don't have to keep going, but you're probably going to want to because you want healthy teeth. It's the same with the spine. Once most people start getting into alignment and recognizing how much more vibrant, how much more healthy they are, then most people choose to keep getting adjusted, but it's not something somebody has to do. It's really because of the health benefit.
That's a good thing to know. But and you also were referencing the technology you use. You said you have some advanced technology. It was actually, for viewers to know, used on NASA's space shuttle astronauts. So can you tell us about that?
Yeah, that is. It's called the Insight, and it's 5 different technologies that was co-developed by the Space Foundation, which NASA co-developed. And so yes, they use it on space shuttle astronauts. And what it does, it gives us more of a insight into a person's nerve system. So we measure everything from the motor function of the muscles that support your spine. We measure the autonomic part of your nerve system through skin temperature, through thermography. We also do something called heart rate variability, which is one of the coolest indicators of your overall health. What happens is when we're healthy and vibrant, our heart rate varies or changes a lot, and so that allows our body to adapt to stress better.
Oh, wow.
As we age, as we decrease in health, our heart rate actually becomes less variable, and we end up having a lot more health problems. And so through the technology, we measure sweat production, and you just sit there for about 6 minutes and measure sweat production, intensity of pulse, the rhythm of a person's pulse, and we get this heart rate variability number. We also measure range of motion. We take all these things, and it gives us one, like your cholesterol number, called your NSFI, your neurospinal functional index, which is the picture of your overall health and wellness now. So you know where you rate on that chart. It's out of 0 to 100, whether you've got a really healthy spine and nerve system or if you've got some challenges that need work.
Well, I want to take a look at some video that we have, because I want people to get an understanding of what you use. I mean, I think it's amazing that you also specialize in correcting postural problems, because I think a lot of people don't consider that they have something, which when we think of sweaters with turtlenecks, we don't think that there's actually something that's called turtleneck. And it sounds very painful. So you need to tell us a little bit what turtleneck is.
Yeah, that's a term we coined a while back, because you think about turtle walks.
Yes.
We see that, though. The more technical name for that's forward head posture. And it is becoming epidemic today. And we talked about some of the things with the birth process where it can start. If somebody's had a bad fall or a trauma, car accidents are a huge cause of it. But maybe the biggest today is computers and texting. And what we're seeing, if you fast forward, if you ever walk through a nursing home, well, if you ever walk through a nursing home, it always grabs me. That's what everybody has in common in the nursing home, is it's almost like their ears have sunk below their head.
You're so right.
Well, we see that starting in people's 20s and 30s now, and in women they get that bump, that fatty hump back there. That's one of your body's way to help, your body's compensating to keep your neck from going forward. What that does, though, is that ends up stretching your spinal cord, and you're not now getting all those neurological signals from your brain to your body the way you're supposed to. It starts compressing everything. Even try breathing when you're hunched over. It's a lot more difficult than when you're upright. So yeah, posture's important.
So you work on that, and when people say sit up straight, really, there's something to it. And I want to tell all our viewers where they can find Health Quest Chiropractic. Actually, you can always call for an evaluation, and you mentioned that's a free evaluation?
Yeah,
that's right. Wonderful. 505-342-2273, and the office number is 505-343-6120. You can also go to the website for more detailed information. And really, there's so much more to it. We're going to be looking forward to many more visits with you to talk about our health and wellness, in addition to the chiropractic needs that we may have.
We are honored to be a part of the show. Thank you so much for having us.
So happy to have you, Dr. Miner. And we will be seeing you soon. And everybody sit up straight. Coming up next, how can you save a fortune at the grocery store? You'll find out.